Findings show that Nigeria has very few radiologists providing services for her teeming population. Another major challenge is the lack of equipment to perform the job, as well as low interest in the subspecialty, owing to inadequate remuneration when compared with other interventional fields of medicine. However, promoting subspecialization of medical doctors in the radiology profession has been identified as key in ensuring patients get access to quality radiography experience in Nigeria. The national president of the Association of Radiologists in Nigeria, Professor Olalekan Oyinloye, says the idea of specialization is to minimize errors and allow better and accurate diagnosis.
Diagnosis is part of practice. So when you subspecialize, you become accurate, you become better in what you do. And that eventually will translate to better management of the patient because you're going to be better in giving more detailed and more accurate diagnosis.
Highlighting areas of subspecialty to include specialists in women imaging and breast imaging, neuroradiologists, those specialized on the brain, while the specialists in children are into pediatric imaging, and specialists in muscles and bones are into musculoskeletal imaging, amongst others. Stakeholders in the profession note that their association is committed towards promoting subspecialization.
Radiology is an area of medicine where we deal with everything, everybody, all diseases and specialties. You know, in medicine we have different specialties: surgery, medicine, pediatrics, O&G, so many. If you look at all those ones, they've so specialized. But for radiology, we've been general radiologists for so long, and the world has left us behind. So we are beginning to specialize now.
We now want to go into the subspecialty in radiology, where we are well defined. We have a defined specialty where we can treat our people well. Instead of we are not jack of all trade again. We want to actually, if I'm taking care of pediatric radiology, I do that. If it's interventional radiology, I do that. If it is geriatrics radiology, I do that. So we decided to partner with the government and people that ask money, whereby we get this minimum equipment, X-ray, ultrasound, whereby we can diagnose some certain things. We can diagnose some simple disease.
With the world now moving towards subspecialists in this profession, members of the Association of Radiologists in Nigeria, ARIN, recently converged in Abuja to chart a way forward to enhance the medical profession. In Abuja, Hakimat Aliu, NTA News.